In this slide, we will talk about safety management and hazard prevention. A direct care staff person provides care for residents in many different ways. As you learned in last slide, knowing a resident's background helps you to assist the individual to be independent. A direct care staff person also needs to protect the resident from accidents and hazards. This slide will help you to learn more about how to create a safe living environment. The two leading causes of unintentional injury and deaths for persons over the age of 65 years are fires and falls. However, there are other residents who, because of mental retardation, emotional or physical problems, are at risk for injury from accidents. Most of these accidents are caused by hazards in the environment that are preventable. An important aspect of prevention is to make sure that medications, chemical cleaners, and other poisons are kept locked. The direct care staff person is responsible for knowing the regulation about fire safety and general safety. In this module, we will learn to recognize fire, electrical, and fall hazards, and steps you can take to keep the environment safe for residents. You will be introduced to safety practices to prevent fires from occurring. Procedures for what you should do if a fire occurs will be described. First, you have to learn how do fires start. For fire to start, it needs four things. Number one, fuel, something that can burn. Number two, heat, to ignite the material. Number three, air, to keep the fire going. Number four, chemical reaction, which is the fire. Fires are a serious threat to people who need assistance with moving quickly or having difficulty following directions. This is true of many residents of personal care homes, residents with mental illness or dementia, or who have functional impairment from any cause or risk for injury. The risk increases dramatically with age. Persons 65 years of age and older are at 2 or 5 times greater risk to die in a fire than rest of the population. Careless smoking is the leading cause of fire deaths and second leading cause of injury for older person. Fires from smoking frequently happens in early morning, afternoon, or late evening when people are sleeping or relaxing. Just imagine a person sits down to relax and lights a cigarette, becomes drowsy and falls asleep. The risk increases if a person drinks alcohol or takes medication that causes drowsiness. Cooking is leading cause of injury from fire and the third leading cause of death. Here are some specific cooking related dangers. A person's Number one, a person leaves a hot stove unattended for just a few seconds to answer the phone or to help someone in another room. Number two, person wear loose-fitting clothing or long flowing sleeves while cooking. Number three, a person leaves hot meats or paper towels near a hot stove and they ignite. Number, number four, a person cooking forgets to turn off appliances. Another source of fire is faulty electrical equipment. Electrical appliances are often used in cooking. You may also be using electrical appliances in the process of assisting residents with their activities of daily living. Some safety measures you can take to prevent electrical fires are: number one, check all electrical appliances for frayed cords or damaged plugs before using. Number two, avoid overloading electrical circuits by plugging in numerous cords. Number three, only use items that have UL tag on them. Number four, do not try to repair electrical equipment yourself. Number five, if an electrical appliance begins to smoke, turn it off, unplug it, and remove it. Number six, unplug a countertop appliance when the appliance is not in use. Since oxygen is one of the three things needed for the fire to start, the presence of extra oxygen in the facility when a person uses oxygen is a special concern. You will want to make sure there is no smoking in areas where oxygen is being used. Matches, lighters, smoking materials, and other flammable products like nail polish, alcohol, and oil should be removed. Clothing made of cotton is best to eliminate the risk of static and sparking. Electrical equipment like radio, toys, and razors can also create sparks. What should the direct care staff person do if there is a fire? If there is a fire in the building where you are now going through this training program, what would you do? Finish reading this sentence. Look around and right course of action is for you to act quickly and race to respond the fire. We use the acronym RACE. RACE. R stands for remove any resident or other person near the fire. A. Activate the alarm to notify others that there is a fire. C. Confine the fire by closing doors that you exit the room. E. Exit. All residents in the home must quickly evacuate outside the building or in some home to fire safe area inside the home. You should always have fully functioning, fully operable smoke detectors in your house. To use fire extinguisher, you should follow the acronym known as PASS. PASS. P stands for pull the metal pin on the upper